Hello everybody, I'm Dr. Kanfer. I own the practice and I am definitely a rabbit addict. So how many of you guys are here specifically to hear the kidney talk? Excellent, great, good. So if you guys have any questions, just you can raise your hands or speak up during or after. If you don't want to talk in a group, you can always talk to me after as well. And so I do apologize for the screen being a little crooked, but I couldn't figure out how to get it more straight. So, okay. All right, so kidneys. First we're going to go over some basic anatomy. In rabbits, they have two kidneys that are present in their abdomen, and they are bean shaped. And the kidneys measure about 3 to 4 centimeters long and about 2 to 3 centimeters wide. Their function is to filter the blood and remove waste products, toxins, and excess water. They selectively reabsorb water and electrolytes with the amount reabsorbed adjusted according to the body's needs. They regulate the blood pressure, electrolytes, and acid-base balance. They produce urine to carry the waste out of the body and produce a hormone called erythropoietin that stimulates the bone marrow to make new red blood cells. So here's some x-rays, and the top one is just the blank x-ray, and the bottom one I've outlined the organs. And you can see here, we have our kidneys, and then the ureters, the bladder, and the urethra, and we're going to go over some more anatomy with that too. And I want you to note also that the left kidney is further back, and the right kidney is further forward, and that's in pretty much all mammals. And then here is a side view. So the first view is a rabbit laying on its side. This view is the rabbit laying like this on the x-ray. And then you can see our right kidney, our left kidney, and then the ureters in this area, and then the bladder. Okay, so here is some more detail of the kidney anatomy. And we can see our big vessels here are vena cava and aorta, and then the renal artery and renal vein going to and from the kidneys, supplying blood to the kidneys. And then here is the left kidney, the right kidney, and this one I've opened up to kind of show you some of the internal structures. And so this area here is called the renal pelvis, a little bit of an open area. And then this is the kidney tissue. The outer edge is called the cortex, and the inner part is the medulla, which has these medullary pyramids. They kind of are a little bit triangle shaped. And then this little squiggly line here is these tiny little nephrons that sit in that area, and we'll talk more about what the nephrons do in just a second. And then so what happens is that the urine is produced, and it goes into the renal pelvis and then out through the ureters into the bladder. And then when the bladder gets full at a certain point, it'll stimulate some nerves to tell the rabbit or the animal to pee, and then it'll pee out the urethra. And I also noted here the adrenal glands, just as sometimes some of you may have had experience with rabbits having adrenal disease, and so that's the location of the adrenal glands. All right, so how do kidneys work? The nephron is the functional unit of the kidney, and each kidney contains millions of nephrons. They're really small, microscopic. Inside each nephron are the glomeruli and the convoluted tubules. The glomeruli are special blood vessels that filter the blood, and they keep the red blood cells and needed substances in the body and remove the excess fluid and waste products. The glomeruli are located in the cortex, that outer part of the kidney, while the collecting ducts are located in the medullary pyramids. Blood will enter the kidney through the renal artery. Blood gets filtered in the nephrons, those little tiny things. Then urine is produced into the renal pelvis and travels out through the ureter into the bladder. All right, so there's different ways you can classify kidney disease. This is one way that I really like to use, which is pre-renal, renal, or post-renal. Basically, does it happen before the kidneys, in the kidneys, or after the kidneys? Is kind of what we're saying. And so when we're talking about a pre-renal kidney disease, what I did is I put a little block here to kind of show you the location. So this is mainly affecting the blood flow to the kidneys. And this usually occurs secondary to another event, another illness, because the other illness causes blood flow to the kidneys to be reduced. This can occur with shock, sepsis, surgery, dehydration, overhydration, low blood pressure, and heart failure. So shock is, you hear about when people are in an accident or something and they're in shock, and it is a physiological state and definitely affects blood flow to your organs. Sepsis is an overwhelming bacterial infection throughout your body, and that also can cause your organs to shut down. And then the others are obvious. In rabbits that have an intestinal blockage, they definitely will have shock, dehydration, and low blood pressure. And so oftentimes you can have a primary bloat, but then your kidney values go up on blood work, and this is why. And that's pre-renal. This is happening before the kidneys. So let's see, we talk about sepsis and prognosis. In these cases, it may be reversible. It usually depends on what the underlying cause is, and so you want to treat that underlying disease and then the kidneys, and then support kidney function. Okay, so renal disease, and this is happening in the kidney tissue itself, and this is damage to the kidneys. Now you can have age-related kidney dysfunction. Most rabbits live about 10 to 14 years, some of them even up to 15, rarely past 15. And, over time, the kidneys are not going to function as well. It happens with a lot of different species where as they get older, some of their organs just, kind of start to give out. Also, you can have damage from an infection. The infection could be from a bacterial infection or a parasite called E. caniculi, encephalozoan caniculi, and they can cause damage to the kidneys. You can have damage from calcium deposits, which is different than stones, and we'll go over that in a minute. If you have a rabbit that's on too much alfalfa in their diet, or greens, like lots and lots of parsley and kale and spinach, then they can get calcium deposits in their kidneys, and then that can affect how the kidneys are functioning. The other thing that can happen is there are some rabbits who may have a problem with metabolizing calcium normally, and even if they're on a good diet, they may still get calcium deposits in their kidneys, and again, affecting the kidney tissue and how it functions. So when you have actual disease of the kidneys, it's not usually reversible, and it's often progressive, but with treatment, you may be able to stop or slow down the progression and give them more time as you manage it as a chronic condition. So treatment is basically supportive. All right, so post-renal, so that happens after the kidneys, after the absorption and excretion occurs. And so I put a little bit of a gray, like as if there was a stone here at the renal pelvis, or maybe there's a stone in the middle of the ureter, or even a stone like the bladder stone that's got kind of stuck at the outflow to the urethra, or also you can have a stone in the urethra as well. And so basically post-renal is going to mean that there's a blockage, and that you can't get urine coming out of that kidney because something is obstructing it. And stones are basically little usually rounded chunks of calcium deposits, calcium carbonate. And so the other thing that can occur is, I didn't have it on this anatomy here, but the reproductive tract is in this area. And so when we spay female rabbits and we tie off their uterine horns, you can get scarring and adhesions. Adhesions are basically like sticky tissue, and then it can potentially cause a stricture and clamp down on the ureter so that it basically forms a blockage. And so I've seen that happen in a couple of rabbits too. Okay. Now the other thing also is a neurogenic bladder. And neurogenic, neuro is like the nerves. And so what this means is there's an injury or disc compression in the spine that's affecting the nerves that control the bladder function. And so if your spinal cord, information is not getting from the spine to the bladder and back and forth, when the bladder gets full, usually there's supposed to be a signal to the spine and to the brain that says, okay, I'm ready to pee, and then the nerves will cause the rabbit to loosen the external urethral sphincter so that then they'll pee. And if there's a blockage or decrease in how those nerves are functioning, then the body is not going to know when the bladder gets full. And so the bladder then just gets bigger and bigger and bigger and stretched out. And sometimes what will happen is you pick up the rabbit and they just dribble urine. As soon as they're picked up, they can have urine all over their rear end. But we'll go into that in a minute. So, but yeah, so the neurogenic bladder basically acts almost like an obstruction because the urine is still sitting in the body and it's not exiting the body. Okay. So here's a picture of a, let's see, it's hard to see on these x-rays, I guess we could dim the lights, but so our left kidney is here, our right kidney is here, and whenever anything that shows up white on x-rays is calcium, like the bone of the spine and the limbs here. So you can see these little stones in the kidney, and then if you look here, then there's some stones in the ureter, and then on this view here, here's our kidney with the stones, and then the ureter travels this way, and so we have the ureter here. And then here's a picture of a kidney that was removed, and it had a big stone in it. Now a stone inside the kidney, you can see how this is just this round rock, basically, which is different than calcium deposits or mineralization, which would be just like calcium just deposited in the tissue on the microscopic level. And so then that's a little bit different. And so with a stone like this, sometimes the stone will move out of the kidney. You hear about people passing a kidney stone. So it's the same kind of thing, is that rabbits can pass a kidney stone. Sometimes they will just get stuck and not move. Sometimes if they're small, they actually can move through. And so okay, so here also, and this is also a good reason why when you're doing x-rays on a rabbit, you always want to get the entire genital area on your x-rays, because there is a stone here at the beginning of the urethra, okay, as well as stones in the bladder. And here's just a picture of a stone that was taken out during surgery, and you can see how big it is, and sometimes they actually can be quite large. And this, as you can see, this was a huge stone in the urethra. And so now the bladder is right here, and that's pretty empty, so this rabbit was actually able to urinate past the stone. When the stones happen this far back, it usually starts in the urethra, as opposed to the stone did not move from the bladder into the urethra. This prior view here, this stone here probably moved from the bladder into the urethra, but when it happens in this part of the urethra, usually that may have occurred, that it grew inside the urethra itself. All right, here's a picture of a neurogenic bladder. I don't know if you can see this whole big bubble. That's the bladder, and it's taking up about more than half of the belly. And the bladder, it should be like this. So that's huge. And the reason why this rabbit had a fracture, interestingly, he had a fracture 2 years prior, and the owner didn't know, and then he was starting to have chronic urine leakage. And so on exam, his bladder was humongous. He also did have, it's hard to see, but there were a couple of little tiny stones in there as well. All right, so bladder sludge we're not really going to talk about, but just in case you guys were wondering, like, is it related to kidney disease? It's not really related. Bladder sludge will show up white on the x-rays because it is calcium crystals, and it basically looks like mud, but usually that's not going to be associated with kidney disease. All right, so signs of kidney disease. How do I know my rabbit has kidney disease? So it could be that they're drinking more, peeing outside of the litter box, peeing small frequent amounts, maybe straining, sitting in the litter box with their butt up a lot more than usual. They might have some urine stained fur, or it could be where it's just yellowish, or it could be that they're actually soaked with urine on the rear end or the back feet. They can have weight loss. You can be like, they're eating fine, acting normal, but they're just kind of losing some weight. What's going on? Decreased energy. You certainly can have where they're acutely sick and lethargic and not eating, but you can also have no signs at all. And so that's why we do recommend blood work to monitor for kidney problems, especially as rabbits get older, because sometimes they're acting fine, but we can catch things in early stages. So diagnostic tests, I don't know if you can read all of that. I really probably should have made that 2 slides. And then this just is a picture of us taking blood on a bunny. We take it from the back leg vein. So there's a couple of different types of tests that we take. And so a chemistry panel checks your kidney values, liver values, electrolytes, and proteins. So for the kidney values, the main ones that we're looking at for the kidneys is the BUN, creatinine. The BUN, it's blood urea nitrogen. Urea nitrogen is a waste product that develops when the body breaks down protein in your food. Creatinine is a waste product from your muscles. When you have elevated BUN and creatinine, it's called azotemia. These values don't become elevated until you've lost more than 80% of kidney function. So you can have a rabbit with some kidney insufficiency that the blood work still looks fine. And that's why, with like people, you can donate a kidney and then you've had 50% kidney function, but you can still get by on just one kidney. And so sometimes if you have one damaged kidney, you can still get by with just the other one. So the interesting thing in rabbits is that oftentimes the creatinine will go up and the BUN will stay normal. Whereas in other animals, other species, it's usually that they're both going up together when there's kidney disease. For electrolytes, the ones that we worry mainly about when we're dealing with kidney disease, for phosphorus, with kidney disease, it can, the phosphorus doesn't get filtered out of the bloodstream, and so then we get high numbers in the blood test, and that can, also phosphorus in the blood can cause calcium to be pulled out of the bones. And it can also, just even having a high phosphorus can damage the kidneys. And so it doesn't happen often in rabbits with kidney disease, but when it does, I do like to use a medication to decrease the phosphorus levels. And that's called aluminum hydroxide. Potassium is another electrolyte. Usually I see this go up in acute, severe kidney disease. And usually these rabbits are really, really sick. And again, it's when the kidneys are unable to properly filter out all of the potassium. Low potassium can occur also, and that can show lethargy or seizures, as well as high potassium as well can make them neurologic. So calcium is bound to albumin, one of the proteins. And so if you have, which we'll talk about protein loss down below, if the albumin is low, then the calcium may be low. And with a low calcium, you need that for your neurologic function, and then also the rabbit can get twitchy and lethargic and maybe even have seizures. So proteins is a big thing with kidneys. They, when the kidneys are not filtering normally and they're kind of letting a lot of things slip by, then you can have protein loss through the into the urine. And let's see, and the proteins can leak out through the glomeruli into the urine, called proteinuria. And so there's two kinds of proteins that we look at, albumin and globulin. Albumin really keeps the fluids in the right places in the body. So if you have low albumin, you're going to get fluid buildup in the wrong places, like in the chest, in the liver, in the belly, and that is usually very, very severe and hard to get them back from. And for the globulin, oftentimes we'll see that with inflammation, which can occur with E. caniculi infection. So another part of blood work that we run is the CBC, called the complete blood count, and that checks your white blood cells, red blood cells, and platelets. If you have elevated white blood cell count, that can indicate infection, but rabbits do this fun thing where they can have a major infection and their white count is totally normal. The red blood cells, if it's elevated, that can occur with dehydration, but if they're low, that's called anemia, and that can occur with any chronic disease and can occur with chronic kidney disease. So, and then I'm not sure if I mentioned it later on, but why would a rabbit with kidney disease get anemic? Earlier I had mentioned that the kidneys make erythropoietin to help tell the bone marrow to produce red blood cells. And so if your kidneys aren't working right, they're not producing enough erythropoietin, your bone marrow is not producing enough red blood cells, and then you become anemic. So that's how we get anemia with kidney disease, chronic kidney disease. So then we also like to do urine tests. And so there's three different tests that I recommend in many cases. The urinalysis is pretty basic, and we check what's called a specific gravity, and that tells us how well the kidneys are concentrating the urine. We check for protein in the urine. We check if there's any red blood cells or white blood cells. There can be red blood cells with infection or inflammation, but also just obtaining the urine sample, sometimes we can cause a little bleeding of a little vessel in the bladder. You could see bacteria in the urine, but sometimes if it's low levels, you're just not going to see it on a urinalysis. And that's why a culture is going to be more sensitive to check for that. Crystals are very common in rabbits, calcium crystals, whereas in a dog, cat, or human, that would be like, oh my God, no crystals. So it is normal for them to have crystals in their urine. And then we also check the pH, which is usually high and alkaline in urine, in rabbits. Another test is the urine protein creatinine ratio, and it just better evaluates the protein. And so you can have, elevated protein on your urinalysis, but the urine protein creatinine ratio will judge that how much protein is lost compared to how concentrated the urine is, and that gives you a better idea of are they truly losing protein. And then also, if there is an active infection, then you can't really judge your urine protein loss at that point because the infection will kind of mess that up. So then there's also the urine culture, which will see if we grow bacteria in the urine, and also we'll check which antibiotics it's sensitive to. It is more sensitive than just looking at the urinalysis. So sometimes other vets have taken urinalysis on rabbits, and then they say, well, there's no infection, and I'm like, well, let's do a culture just in case. So I just like to be a lot more detailed with that. Okay, more diagnostic tests. X-rays, and you might say, like, why are we going to do X-rays on a rabbit that has, kidney issues? We're going to check for stones in the kidneys or urinary tract. It's definitely going to give us a better idea of what's going on. We're going to assess the kidney size and kidney shape, but we're also going to check other things. We're going to see if there's any fluid built up in the lungs, if the kidneys are not working right. We're going to check for other diseases like heart disease. If we have an enlarged heart and heart disease, then that's going to affect our treatment for kidney disease, because when we're treating the kidneys, fluids are our main therapy, and giving those fluids can actually be tough on the heart. Okay, and we're going to check for other diseases, cancer, a lot of gas, arthritis, liver disease, so just to know if we need to treat anything else, and also how it might affect our treatment for the kidney disease as well as the prognosis. In some cases, we also do an ultrasound. It gives us more information. It's maybe not as important, I think, as the other ones, other tests, but we just look at the kidney anatomy and the blood flow, and it just tells us how advanced the kidney disease is. And then there's some pictures of some kidneys on the ultrasound. Blood pressure we'll do in some cases, because the kidneys regulate blood pressure. If the kidneys aren't working well, the blood pressure can become elevated. But then this also can then damage the kidneys further. And so if we do have hypertension, high blood pressure, then we're going to want them to put them on medication to try to get the blood pressure down. Okay, so now on to treatments. So going back to the pre-renal, renal, and post-renal. So if it's pre-renal, again, treat the cause, correct dehydration, correct low blood pressure and shock, correct fluid overload and sepsis, and then and then support your kidneys with fluids and get them moving, get them working again. If post-renal, like a stone, then we're going to treat the cause again. If it's a kidney stone, we mentioned that it could be either calcium deposits or an actual stone. I've seen several rabbits over the years that have either kidney stones or kidney mineralization that just live with it, and their kidneys are still functioning okay. We just know that they're not fully functional. And I've only had a couple of cases where they really that kidney was causing them a lot of pain. They felt like crap, and we had to actually remove the kidney. But a lot of times it's just like the kidney just becomes defunct and just sits there and doesn't bother them. So I've seen that in a lot of rabbits. Let's see, certainly if, so ureteral stone, it can be challenging to remove those in dogs, cats, humans. They go, oh my God, you're going to cause stricture of the ureter, and certainly, absolutely, you can. The ureter, when you have a stone in there, the ureter is going to be widened, and so a little bit easier to find than if it was a normal ureter. You could still have a stricture. So basically, it's kind of like, are you going to wait and see if the stone passes, Or do you go in there and do you try to take out the stone, or do you just take out the kidney on that part? So again, I do judge that based on how the rabbit is doing, because if we find it as an incidental finding on an x-ray, like maybe they had a little decreased appetite, or they bruised a toe, and we just said like, oh, your rabbit is 8 years old, let's get an x-ray, and then we happen to find something but they have no signs, then maybe we don't do surgery. But if they come in, they're not eating, they're in pain, then we may be more likely to go to surgery. Okay. Urethral stone, so that's way at the end, and that usually can be removed. So in dogs and cats, you kind of like push the stone up into the bladder, but in rabbits and guinea pigs, oftentimes either it's too big, because again it formed in the urethra, not in the bladder, or you don't necessarily need to, and their urethras are pretty wide compared to like a cat urethra, and so in rabbits we're more likely to either do an incision over the penis or the vulva to remove that stone, or even try to get it out through the opening. And so you guys know what an episiotomy incision is, like when women give birth, sometimes they do an incision to enlarge the opening, and so you can do that sometimes in the rabbit, where maybe the stone just doesn't fit right out the exit, and so you can just make a little incision, get the stone out, throw a suture in there. So sometimes we do that too, but sometimes just anesthesia or sedation, stretch it out and just get it out. Sorry, people are studying. So, and then treating neurogenic bladders. Emptying out the bladder, sometimes we'll place a catheter to drain it out completely and keep the catheter in for a few days so that it can just stay really empty. And once that muscle, the stretch starts to decrease and it starts to contract better, having the owner doing the expression at home, usually like 3 times a day for the rest of that rabbit's life. And then usually that's going to help a lot. So we also are going to want to monitor any of these cases for future stone formation, and also probably give them fluids to try to flush things out. We'll talk about the medications in a second. But I do like to recheck x-rays every few months, because if you get rid of the stone, they passed it, or you removed it surgically, like if it was a bladder stone, if you check x-rays frequently and you find a new stone when it's small, sometimes you can get them to pee it out with extra fluids. So that's why I like to check frequently. Additional procedures, a lot of people say, can we do laser lithotripsy? And so, I misspelled that word. So the laser lithotripsy is used to fragment the kidney stones into fragments small enough to pass spontaneously or be removed by less invasive methods. It does still require anesthesia and a laparoscopy, so there still has to be an incision into the belly to get close to the stone. The benefit is that you're not cutting into the kidney, but the cons are that the stone fragments might still be too large to pass through the ureter. This is usually performed in humans and dogs, but in cats, most cats are even still going to be similar size or bigger than rabbits. In cats, it's not used as much because those stones, they can't break them down small enough to pass through. And it's not like you can just hold the laser on the side of their belly and get it done. It's still an invasive procedure. Endoscopic retrieval, like if it was in the urethra or bladder, that certainly could be possible, but again, usually if the stone is too big, is it going to be passing through the urethra? So, and there's would definitely need a specialist who is experienced with using those kinds of scopes, and there's not a lot of people in the area that do that. And it is definitely challenging because of the rabbit size. So, in treating for primary renal disease, where this is the actual kidney disease, fluids. So we want to increase fluid intake. And people will say, well, can I just get them to drink more water? It's not enough. They need to have fluids either by, if they're in an acute situation, they actually will get intravenous fluids. If it's for chronic, then fluids under the skin. Majority of rabbits tolerate fluid under the skin very, very, very well. And so usually it hurts us more than it hurts them. So the owners are more like, oh my God, and the rabbit's like, just get it over with. So the fluid, when you increase their fluid intake, It helps the blood flow through the kidneys better and more frequently. It gives the kidneys more chances to remove the excess creatinine, the excess urea nitrogen, and the extra waste products. So it just gives them more chances. It also is going to dilute things out so that there's less likely to be calcium deposits, and also helping them pee more so that they're going to pee out those wastes and pee out the calcium. See, we definitely want to treat any underlying infections. I do see a fair amount of kidney infections in rabbits, and so in one, and that's actually where it's a very treatable thing. Let's see. So if there's an E. caniculi infection, you can have rabbits who never have any neurologic signs of E. caniculi, but they do have E. caniculi that may cause damage to the kidneys. Usually what'll happen is if I see, say, like a 6 or 7 year old rabbit that has a decreased appetite, and we do blood work and we see that the kidney values are elevated, and we do all of our tests and we decide it's not something else, but it's a primary renal kidney disease, and we'll check for E. caniculi, and they're going to be positive, and that if it's a 6 or 7 year old rabbit, those kidneys are damaged from E. caniculi. If you have a 10-year-old rabbit with primary kidney disease, maybe that's from age. It may not be from E. caniculi. It might, but it may not be. So let's see, because the problem with the E. caniculi is that sometimes a positive test doesn't necessarily mean that they have an active infection, or that it's affecting them. So, but the problem is that the damage may be done, and you can't undo that damage that may be caused by E. caniculi or a bacterial infection. You can have a bacterial infection in the kidneys. You can also have a bacterial infection elsewhere in the body that can also affect the kidneys. So dietary, and this kind of goes for all of the kidney problems, is that you want to avoid foods that are high in calcium, like alfalfa, kale, parsley, and then spinach is more goitrogens, but still we try to avoid that. We want to encourage water intake. I know that some people have tried using some of the fountains for rabbits. I don't know that it helps them or not. It's something that's very popular with cats. But what we'll do to increase water intake is to make their greens very watery. And so almost like soupy. Sometimes you can syringe them water. Occasionally we'll flavor the water a little bit. But if you do flavor the water, I still like them to have plain water. And I do feel like it is more natural for rabbits to have a bowl of water than to have a bottle. Okay, and then people worry about protein intake with kidney disease. Doesn't really seem to be an issue with rabbits. And sometimes if they're losing a lot of muscle, a lot of weight, then we actually will supplement them with protein. But we'll use a vegetable-based, like soy protein or something like that. We want to avoid whey protein or animal protein. Okay, some medications. Sometimes the rabbits are feeling crummy and we want to give them pain meds, or they have something else going on, or they're passing a kidney stone. We want to give them pain relief. And so one of the most common pain relievers that we use in rabbits is meloxicam, which is like the bunny version of Advil. Problem is that it's going to, it can be tough on the kidneys because it narrows the blood vessels and decreases blood flow to the kidneys. And so we usually will try to avoid that if there's any kidney issues. If the rabbit has like an episode of kidney disease, like maybe a little infection in the kidneys, and we got it to cure, for the rest of that rabbit's life, I'm still going to baby those kidneys and be real careful and only use meloxicam if we really need to. Sometimes if we really need to use it, we'll then also give them fluids at the same time and then monitor their blood work closely. Even for rabbits that don't have kidney problems, if we're going to be putting them on some chronic meloxicam for like arthritis pain relief, then what we'll do is we'll test blood work before starting it, and then maybe after a month, and then every 6 months, just to make sure that their kidneys are tolerating it okay. So let's see. So if they have a high blood pressure, there are some medications we can use called telmisartan, benazepril, or amlodipine. And usually then we'll repeat blood pressure to make sure that it's working. We get varied effects. Sometimes it works really well, sometimes it doesn't work very well. The amlodipine is used a lot in cats, and that actually can oftentimes cause decreased appetite in rabbits, but they usually tolerate the other two pretty well. Prazosin is a medication that'll work to dilate the ureter and urethra and may help the rabbit pass small stones. It also can help with the neurogenic bladder and may help the bladder work better. And so I do use that in a lot of cases. Supplements, dissolved KS is something that was recommended to me by a homeopathic doctor, and it's supposed to decrease the calcium deposits, and it does seem to help. I mean, when we have rabbits on it, it does seem to decrease the calcium deposits and stone formation. Oxbow and Sherwood have urinary cookies, which are just really good supplements to give them. And then there's acupuncture. Now, it makes sense to use acupuncture for arthritis. You know, you've got arthritic pain, or muscle pain, and then that kind of makes more sense to us. But you might think like, well, why does it work for kidney disease? So it's, I'm not going to go into the details of acupuncture, but I've had a couple of cases, mainly the 6-year-old rabbit with significant kidney damage from E. caniculi, and where all the other medications they were working, but just not well enough, and we put the rabbits on acupuncture, and definitely it improved their quality of life, it improved their kidney function, and they definitely got many more months of living with the kidney disease with acupuncture. So I am a proponent of that with these chronic cases. So what's our prognosis? So again, pre-renal, it depends on the underlying cause, and some of those causes are very, very life-threatening. Renal, usually slowly progressive, but can live with kidney disease for 1 to 3 years. I mean, most of the rabbits that are getting this are going to be already 9 or 10 years of age, and so if they live their normal lifespan with it, managed, if we do have a 6-year-old bunny, 6 or 7-year-old that has, kidney damage from E. caniculi, usually we're kind of like 1 to 2 years, depending on how things are going. Post-renal, usually a good prognosis with removing the blockage, but definitely we'll still need to keep on fluids and supplements to prevent future stone formation. This is my favorite little. So. All right. Any questions? Yes.
You mentioned that you check the bunny's pH. What is the normal pH for a bunny's urine?
Usually around 8 to 9.
8 to 9.
Yeah, and that's interesting thing is that like in guinea pigs, they very much form stones, and a lot of people will use potassium citrate to try to acidify the urine, because the acid, or whether it's acid or basic, can affect what kind of stones or crystals they may have in a lot of different species. And so the thing is though with rabbits and guinea pigs, their pH is so high and so alkaline, you just really can't acidify it. You can give them all these acidifiers and they just don't really seem to do much, So, does potassium citrate work in those cases? It doesn't hurt, but I haven't really feel like it works, so.
You also mentioned that, in some cases you have to take one of the kidneys out. So, does that diminish the length of the lifespan of the bunny?
Yeah. Whether you take out the kidney or if the kidney just sits there and it's just not working, you're still left with just one kidney, which, it may have a more limited lifespan because of that, because you've already lost 50% or more of kidney function. And so if you have one functional kidney, whether this one is removed or whether it's just non-functional, that one is going to work harder because it's doing all of the work for the body, and so it can kind of get old faster. Yeah.
And lastly, is it a good idea to give them supplements as a preventive way to avoid kidney stones?
Not necessarily. It's not going to hurt them to have the urinary supplements, I guess, but I don't know that it's necessary. But I think if there's any evidence of disease, then absolutely. And it's hard because sometimes it's like, we do, 3 medications to help the kidneys, and then these other medications to get keep their intestinal tract moving, and then maybe an antibiotic, fluids, and then to add on to that supplements, it's like, okay. So sometimes it does become a lot. But I think, and I'm not sure, I don't think I mentioned that we do recommend that rabbits get blood work performed. Certainly every year is ideal, but definitely starting by age 7 or 8, and then every year. And then as they're getting older, like 9 or 10, sometimes even twice a year. I've seen rabbits that were doing fine, had their routine senior blood work, and then a month later came in sick with, kidney disease or some other disease, and their blood work was completely different. So it can happen fast. And so, that's why we do recommend that as a routine, just monitoring test when they get older, but then also at any sign of any problems. We're like blood work x-rays, we want to know, because yeah, it could be just basic GI stasis where they stop eating but they're otherwise fine, but a lot of times they stop eating because something's wrong. There's a blockage, there's a twisted liver lobe, maybe there's a kidney stone, maybe there's an infection. So when a rabbit stops eating, we like to know why. We try to figure out why. All right, sure. Any other questions? Yes?
We had a foster that we just lost, unfortunately, due to renal failure. And she stopped eating. We took her in after like the 24-hour mark, but we had no idea what was going on. So is there any other signs that we should look out for in the future?
How old is she?
She's 4.
Yeah. I mean, again, as I mentioned, it can be that the kidney failure was secondary to something else. She could have had a blockage in her intestinal tract that caused the kidney values to go up. It could be, I've even seen it with liver twisting, that we can have the kidneys go up. It could have just been a severe overwhelming infection, severe dehydration. So yeah, I mean, primary kidney failure, acute kidney failure could happen, but usually there's going to be a reason. It's either that they're damaged, previously damaged from something else like E. caniculi, or maybe there's a severe overwhelming bacterial infection. So usually what I've seen is that in around age 6 or 7, we'll see kind of a chronic kidney disease secondary to E. caniculi. If we have like 8, 9, 10-year-olds and older, then it's a little bit more likely to be from old age. And then other than that, it's either it's the stone or it's secondary to other illness. Yeah. Okay. Anybody else? Any other questions? Okay. Thank you very much. What? Oh, yes. And then also, so do you want to just shut off the video?